There's up to 70 to 90% excess weight loss at 3 years with a duodenal switch. So I tell patients, how do you kind of pick, even just from a BMI standpoint? If the BMI is under 45, most of the time a sleeve is more than adequate to help the person lose enough weight to get to that healthy goal of about a BMI in the high 20s. If your BMI goes over 45, so if your BMI is under 45, maybe you're only 100 pounds overweight. When your BMI goes over 45, now you're maybe 120, 150, maybe 175 pounds overweight. You kind of get into where a bypass becomes the more ideal operation because the weight loss is a little bit better with the bypass. And then once your BMI goes over 50, now you may be at the 150 to 200 pounds overweight or 250 pounds overweight, whatever the case may be. The sleeve with the duodenal switch is now sort of becoming the more appropriate procedure. But again, that'll be a consultation with your surgeon when the time is right to decide like where do you fit in that spectrum of those three procedures. The duodenal ileostomy compared to the gastric bypass, though, has a few less risks of side effects like an ulcer or problems like what's called an internal hernia. So some patients, they need that extra malabsorption, but they don't want to take the risk of a gastric bypass getting an ulcer later, and they might choose to go with the duodenal switch in that situation.